It stays here, I think.
The bulk of the lesion is not venous.
Survive this limb or not? That is the main thing. My idea, if
Arthritis pathologists, because they will just look at it. So they will neglect all the fibrosis and they will find abnormal veins. The disease is here, but the disease actually is pretty.
No, not
And you can actually feel the arteries. Surgery, and then you go and resect as much as you can. Before that,
hopefully we'll get
then
that.
it is regular here. Sometimes you may ask the patient to have the head.
Easily compressible,
Almost completely compressible.
but at that time there is no increasing swelling. So
But the thickening of the upper eyelid, the same. The intraconal component is probably. And how does it look over here? Surgeon.
After giving these
After stopping locally or now, if you want to or considering injecting. I don't see it.
Yes, reddish.
Oh, this is leave something in the middle. So anything I inject after that.
Here the swelling here.
I eat one time a day at 9 p.m. That's it. That's the same.
It's not opening here. It's take time.
Oh, okay.
CM can be normal.
Yeah, hemangiomas where they go to the lip on both sides, the involved and the non-involved.
Which is very good.
and it is because already
For venous malformations, actually, more that would go to independent areas sometimes as fluid wouldn't go to. You need to push the whole thing back to here. And if you do it, yep.
So that can be accepting intervention of the endothelium. Injection is
And it seems to be compressible. Again, it's not the. The problem with injecting these long veins is that you don't know where they drain to. Sort of milder case with little.
ready sir আপনাদের একটা ইনজেকশন আছে কিন্তু দিয়ে দিত তখন
And it seems to be compressible. Again, it's not the. The problem with injecting these long veins is that you don't know where they drain to. Sort of milder case with little.
ready sir আপনাদের
Speech of our Honorable Prime Minister, formally established vascular anomalies treatment and research.
এই রোগটির কারণে বা এই বিশেষ ধরনের রোগের কারণে নানান রকমের এই কানেক্টিভিটির যুগে এই এত রকম খুব অনেক একটা উন্নত জায়গায় পৌঁছে গেছে এবং
পররাষ্ট্রমন্ত্রী ডক্টর দীপুমণি বইটির মোড়ক মোচন করবেন।
লাভবান হবে। আমি বিশ্ববিদ্যালয়ের পক্ষ থেকে as a token of love, as a token of representation of the university.
অবশ্যই আমাদের ম্যানেজমেন্ট ভাস্কুলার the relative of the people to take.
যে আজকালকার যুগে ইন্টারনেটের আজকের এই একটা প্রচেষ্টার থেকে ভবিষ্যতে
প্রপার যে সময় চিকিৎসাটা হওয়া দরকার সেই সময় হয় না বলে থাকি যে এখন আমরা মোস্টলি এগুলো নাও করতে পারে অথবা যেটা হয়তো আমি এক্সপেক্টেড।
On behalf of CARE, I'm here to I'm very thankful that you all have come to
Walaikum. First, I like to say thank you to the organizer.
So I'd like to thank everybody to be very patient and waiting and listening to everybody's talk. And so I have 3 points. I'll try to be very brief because we are running a little behind time.
Anomalies. These are hemangiomas, and this is hemangioendothelioma. Vascular stains, cutis marmoma, marmo, and propanolol for hemangioma, and sometimes we can give chemotherapy.
Anomalies present in the exposed area. At first,
the vascular surgeons, but by the time at the end of 5 years, the child would be a face like this. If you see this, you should certainly examine the brain, because we now know of the associations called face.
You check with ultrasound or with the Doppler. The small portable Doppler machine, by the way, is very valuable. If you have no radiologist to help you, if you have it in your hand, you can people from different specialties. Often the room is much more, or eventually, to take the call. If the call is clinical and they have to deal with clinical situations, in the United States they have the system of. I personally think alcohol is cheap and good, but people don't like to use alcohol because it's very difficult.
Before asking my question, I have to say something about vascular anomalies.
Type of vascularity mixed with venous type of vascularity, that's one thing. And sometimes we
used for the venous malformation anywhere in the world. Actually, I was working in JSIC, but there were some of our patients.
and the trend is to embolize or sclerotherapy or combination in stages.
One give a good hand. Thank you. Now this is the time for lunch, and the next no more program. Time for lunch, then you go home. Thank you.